I think we are ready to get started. Good morning, and thank you for coming out here to the MLK Senior Center. I am North Las Vegas City Councilwoman Pamela Goins Brown. The community we are standing in today, the neighborhoods outside of this building, have been some of the hardest hit by the COVID-19 pandemic. The residents of North Las Vegas and surrounding communities, like the historic West Side, have been some of the highest rates of sickness, hospitalization, and death due to COVID. At the same time, residents in these hardest hit neighborhoods have registered for the vaccine at a much lower rate than residents in other parts of the county. It's a glaring disparity that we and our partners are working very hard to address. From the very beginning of this pandemic, the city of North Las Vegas has been focused on doing everything in our power to help our constituents survive this pandemic. We have pumped almost every penny of CARES money that we received directly back into the community to get people tested, to support struggling businesses, and to keep people in their houses and employed. This was not an accident. It was by design, to have the greatest impact possible in helping our constituents weather the impact of this terrible, terrible virus. We are taking the same proactive approach to vaccinations. To date, we have registered almost 25,000 people for vaccines and administered almost 13,000 shots. In addition to our permanent pod at Canyon Springs High School, this past weekend, we held a pop-up vaccination clinic at Rose Garden and Owens Senior apartment complexes in downtown North Las Vegas to ensure that residents in the communities most impacted get vital protections. If there is one message that I hope you take away today and share with your audience, it's this: the COVID-19 vaccine is safe to get. The vaccine is most important to get. Please, please, please register to be vaccinated. The more immunity we can create, the more lives we can save, and the faster we can open up our community, save our small businesses, and get people back to work. We'll continue to work with our fantastic partners to spread the word and encourage and enable more and more people to get vaccinated. We'll be holding more registration events at neighborhood grocery stores and churches, doing more pop-up vaccination sites like this one, and work with Congressman Horsford and our federal and state delegations to ensure that a fair share of vaccines come to Southern Nevada to protect our community and those suffering the greatest impacts of COVID-19. I'd like to thank Commissioner McCurdy for helping us to lead this effort with me. I also want to recognize Chairwoman Marilyn Kirkpatrick for her incredible leadership throughout the pandemic and her support in securing CARES dollars for the city and to be able to stand up efforts like this one. I also want to thank the incredible staff here at the MLK Center and the Clark County Economic Employment Opportunity Board, which operates this site, for helping us connect with seniors who desperately want to receive the vaccine. This is just another great example of the regional partnerships that bring us all together to help our residents in need. Working hand in hand to put the community first, we will overcome COVID-19. I urge all of our seniors in North Las Vegas and across Southern Nevada, and especially those in the communities suffering the most, to please register to be vaccinated. It's quick and it's easy. So just visit covid.southernnevadahealthdistrict.org/testing/. So thank you again for helping to share this critical message. And with that, I'd like to introduce to you Commissioner William McCurdy.
Hello, everyone, and thank you all for being here. And thank you, Councilwoman. It is always a pleasure to team up with the city of North Las Vegas. The fight against COVID-19 has been a community effort from the very beginning. Our initial outreach efforts focused on educating our community about the steps all of us needed to take to help protect ourselves and our families from COVID-19, which included social distancing, wearing face masks, frequent hand washing, and getting tested when you experience symptoms or have come in close contact with someone who has had COVID. Now, with the rollout of the vaccine, it is vital that we continue to educate our community about getting vaccinated against the spread of COVID-19. The sooner we all get vaccinated, the faster we can put this pandemic behind us. Currently, vaccine supplies are limited, as you all know, but we are working to ensure that all of our eligible community members get vaccinated and have the opportunity to do so when it is their turn. Our goal is to offer a shot to anyone in our community who wants to get it. And once we get a larger supply in, we will expand our efforts to more groups of people. And there are some challenges to overcome in our communities of color in regards to getting vaccinated. Vaccination rates in the African American community as well as our immigrant communities are not what they should be because of the fear and also mistrust. This cannot be overlooked. This is a nationwide problem, and it is important to know that thousands of people volunteered to help test the COVID-19 vaccines and ensure they were safe and effective before they were offered to the public. Because the COVID vaccine supply is currently limited, we must now take the steps to ensure that populations who have experienced systemic health care inequities have access to appointments and receive the vaccinations. One way we are working to address this is to target underserved communities and underserved neighborhoods with our community health team operations like today that we are all witnessing. Folks are lined up around this door, and they are ready to get vaccinated. And our approach is the exact same as it was when we offered COVID-19 testing in targeted areas of our communities. We deploy a team to a senior center, school, or other facility within the hardest hit areas to make sure that the resources are available to all who need them. Today and tomorrow, this facility is offering over 400 appointments each day to people who live in nearby zip codes and in areas that have seen the highest COVID-19 symptoms and high COVID-19 caseloads. And to make people aware of this opportunity, staff at the center and in our community liaisons office reached out to clients and contacts in the community to help eligible seniors sign up for available appointments. We also want to speak directly to the friends and neighbors within our African American and immigrant communities. If you know seniors who want to be vaccinated, please help them book appointments online and through the Health District's website at www.snhd.info/COVID. I've talked to many people who have gotten an online appointment and booked appointments also for their neighbors and for their relatives and also for their friends. Many seniors are not technically savvy, but the children and grandchildren are. So we all have a part to play in making sure that everyone gets vaccinated. And in a lot of cases, not everyone has a smartphone or a good internet connection at home. This is a reality, and especially in some of our hardest hit zip codes. And in these cases, there are phone numbers that our seniors can call and also their friends to help them get appointments scheduled. This is our priority to make sure that the hardest hit communities receive the vaccination to help mitigate the spread and ultimately get our economy back on track. The Southern Nevada Health District's vaccination info line is 702-759-1900. It is staffed Monday through Friday, 8 a.m. to 4:30 p.m. The state of Nevada also has a line that they've launched in order to help facilitate more vaccinations. And that number is 1-800-401-0946. And that is also staffed from 8 a.m. to 8 p.m. 7 days a week. We are working around the clock to ensure that every community member who wants to get vaccinated is able to do so. So please help us get the word out about these resources and help those who are struggling to get online and remind them to call these centers and get the resources that they need. And also, you can tell people to call 211 if they are in need of transportation resources to the clinics. And I would like to remind us all that we are all in this together, and we all need to work together to keep each other safe and healthy. I would like to now call Councilman Scott Black, the chairman of the board of the Southern Nevada Health District. Please, Councilman.
Good morning, ladies and gentlemen. It is really an honor to be here this morning. As I walked in, I could truly feel the energy and the optimism here at the Martin Luther King Center as these seniors within our community are coming here to really receive this life-changing and in many cases life-saving vaccination. I'm honored to be part of the North Las Vegas team as a city councilman, and I'm very proud of the work that the city of North Las Vegas has done under our city's leadership, and primarily our fire chief, Joseph Calhoun. We have literally developed a program in-house to facilitate vaccination access to many parts of our community that have been disproportionately affected by the COVID-19 pandemic. However, I would like to, even though I'm so proud of North Las Vegas, I also want to talk a little bit about more from the perspective of my role on the Health District Board of Health, the work that's being done by the Health District and all of our community partners, both public and private, and all the jurisdictions to really address this COVID pandemic head on. Even though the vaccination rollout is relatively new, and in our community we've been going for about maybe 5 or 6 weeks roughly with the vaccination rollout, we've put 240,000 plus vaccinations out into the community, into arms. Over 200,000 first doses and approximately 40,000 second doses. In a short period of time, we've been able to scale that up, and we're getting the vaccines out. But way before the vaccine rollout occurred at the beginning of 2021, the Health District has been working diligently, along with all of our municipal and community partners and emergency managers, for over the last year. It's been literally a year now since we've been fighting the pandemic head on, and the Health District has done so on many, many fronts. It's data driven, it's testing driven, it's recommendations for safety, it's wearing masks, it's washing hands, it's social distancing. All of those things have played a vital role, and I'm very appreciative to the Health District for their messaging and their leadership, but I'm also thankful for the community for taking this seriously, because it is important that we take it seriously. I've lost friends and loved ones because of the pandemic, and I know many of you have as well. So I just want to reiterate what's been said by Councilwoman Goins-Brown and Commissioner McCurdy, that we're bringing this based on the data that the Health District has acquired through testing, through contact tracing, through disease investigation that they're expert in their expertise in doing so. We've identified that there are many communities within Clark County that are disproportionately affected, and that's why we've been strategic and are trying to be more strategic at every level throughout this, whether it's testing, whether it's education, and then now, of course, we're at the stage of getting the vaccine out. We have strike teams that are being developed from the Health District with their leadership and partners. The partnership and the collaboration has been wonderful, and I just want to encourage people, as others have stated this morning, that the vaccine is good, the vaccine is safe, and the vaccine is an opportunity really to keep people in a healthy state, as well as open our community and open our economy and get our economy back into a healthy state as well. So thank you so much for being here this morning. I think I'm introducing Mr. Jeff Quinn from the Southern Nevada Health District.
Thank you much, Jeff Quinn, PHP Manager for Public Health Preparedness, Southern Nevada Health District. And while I thank everybody here that presented, it really is a team effort to get vaccine out to the community and to reach all the populations that we have here. With that, I think we're done with the presentation speaking portion of it, and we're here to answer questions that you all may have.
Why do you think it is that there's more of a fear in the community right over here to get vaccinated? What do you think the fear and the distrust is?
It could be a number of things. I mean, the vaccine, the relatively short period of time that our governments around the world have manufactured this vaccine and rushed, not necessarily rushed it out, but it didn't go through the normal processes. Normal vaccine takes many, many years, and this came out triumphantly within a year, which is good news for us as a society, but that may be some of the fears that people have with experiencing it. And I think, a lot of people want to see how other people that get the vaccine, how they do with it. It's just kind of a wait and see. I imagine that more people will get vaccinated once they have friends and family that get vaccinated and do very well with it.
We're hearing a lot of, there's a lot of misconceptions out there about the vaccine. We hear it specifically in my Hispanic Latino community where, they fear maybe the side effects, they fear the not knowing. I do see around right now, I'm not seeing a lot of Latinos getting the vaccine. Can you tell us, what are you guys doing to actually, get on board or get them to feel a little bit more safe about this? Is there any PSAs or anything that's really targeting these groups?
Right. Yeah, and we do have a vaccine campaign in our Hispanic neighborhoods and Latin American neighborhoods, and also I think we're out in the communities, the Hispanic communities. We're out at El Dorado High School today, which is a very high predominant Latino neighborhood. But we also need to get the message out through multiple media systems and non-traditional mediums such as TV, radio, and also word of mouth. We want folks to hear from friends and family about locations that we have opening in the community for people to go get vaccinated.
So we're talking about North Las Vegas today. What about other underserved areas? Or how are we targeting those other areas? Are we going to be doing the same thing for them? Or, because I know there's a lot of...
We are actually going to expand that outreach, not just in North Las Vegas, but other jurisdictions. First of all, we had to start with our marketing materials to get them translated into multiple languages so that everyone has access to that information, because they did not at first. Through social media, through phone calls, through emails, through whatever kind of media channel we can get the word out, and then partnering with other community centers in higher Hispanic areas or non-English speaking areas, churches. If schools will let us open up, we were just partnering with all different kind of places to get the word out and get more people vaccinated.
And then this is my last question. I know you guys had partnered up with a lot of pastors,
Yes.
priests, and they were trying to, put the word out in their local churches and whatnot. How's that working out? Are we going to look for other resources or other people to actually get them on board?
Our hope,
Actually deliver the message?
yes, the answer is yes. And just having conversations, and I can just use me as an example, with pastors in my circle, with surrounding churches and to my ward, we absolutely have reached out to them to get the word to their congregation. And then once we get numbers and this, just an estimate about how many people are interested, we will definitely set up something for them. Okay. Yes.
In addition to outreach and education stuff, today's event, for example, is here located physically in a hard-hit zip code.
Yes.
Trying to get people from the area to come here and get vaccinated, especially if they might have trouble getting to other areas of town. In addition to education campaigns, stuff like that, are there going to be more vaccination centers in hard-hit areas that give some form of, maybe exclusivity is not the right word, but first dibs, so to speak, on for people from the local community to sign up and come get vaccinated. So it's not just people that have the means to travel from across the valley to get to a site. It's a different neighborhood.
Well, the goal for being here at the MLK Center was first to give priority to the membership here, because this center has thousands of people that are members of this center. And then they were first priority, and then we definitely opened it up to other people in this zip code area, because we want to try to just broaden the vaccination to like our 89030, 89032, and our 89031 zip codes. But we definitely will expand as the need arises.
And so, yeah, just to be clear, my question was just like this,
Yes.
the strategy for this site, is that going to be expanded to other areas?
Okay. Yes.
So to answer your question, the strategy in terms of reaching communities that are being disproportionately, either they're not taking advantage of the signups, or they don't have the ability via technology or a language barrier. There are open pods for distribution, points of distribution or dispensing, and there will be closed pods. The closed pods will be invitation only, specifically geared. So let's say, for instance, you have 400 doses, and you have identified 400 individuals within a community, a neighborhood. The health district will assemble that type of setting, go out and do proactive outreach, and then have a closed pod, meaning those 400 doses are only going to those 400 targeted individuals or individuals within that area. as opposed to an open pod, which would be you can sign up on the internet. Like this one was targeted to members of the MLK Center, but of course we had vaccination spots open to expand that. So this is more of a hybrid. You have purely an open pod where anyone from any zip code within the community could sign up, like at the Cashman Center, or when it was at Western High School, or at Canyon Springs for that matter. But then we will have closed pods as well.
Thank you.
Yes.
Last week we have 10% of Latino, Hispanic, and 4% of African American between those who were vaccinated. So do we see any change of those numbers for this week?
Well, we may, because we're doing, you know, I do want to remind the public about, you know, taking the statistics with a grain of salt. I mean, right now we have limited vaccine. We're doing targeted priority groups. And if you look at the diversity of a particular profession, frontline healthcare workers, it pretty much covers the gamut, but it doesn't necessarily follow the general population as far as the diversity breakup of the mix. With targeted events like we're doing for our seniors, I think we'll see the statistics change. And as we get further, more and more vaccine, and we start opening up more and more groups, once we get to some of the other professional groups that are in the community first responder groups, we'll see those numbers change as well, and it'll be more reflective of the current demographics.
Time for two more questions if we might. We want to make sure you can get out and see some of the action as well.
And what I would like to do at this point is I will speak directly to how we are looking to approach getting the vaccinations into our Spanish-speaking communities. I represent Commission District D, which covers a majority of the city of Las Vegas and North Las Vegas, extending all the way to East Las Vegas past Nellis to Christie Lane. So what we are doing is we are taking a multi-pronged approach. As you all heard from Mr. Quinn, is that we're looking to, this is going to be a tiered system, but in regards to outreach, there is not going to be any stone unturned in collaborating with not only our media partners, radio partners, as well as looking at strategic initiatives to communicate directly to the communities that have been hardest hit. We're also going to partner with, like you heard before, our religious leaders, our community organizations, in addition to our other elected officials that represent majority Spanish-speaking communities, like Councilwoman Olivia Diaz, as well as Councilman Isaac Barone, who I've had the pleasure to speak with. So we are going to be fully coordinated in our approach to make sure that the hardest hit communities have the resources that they need to get vaccinated, be educated, and then ultimately get back to work, because that is what we all share a desire in making sure that happens. In regards to the Black community specifically, we know without a doubt that there has been systemic racism as it relates to vaccinations, and that is a fact. We can talk to the Tuskegee Project and other instances to where Black folks were negatively impacted by the healthcare system, but that is not today. And today we are at a phase in our vaccination process to where we are strategically communicating to folks who already are apprehensive about taking the vaccination, and also giving them the knowledge and information and also the comfort that they need to know that this has been well thought out, in addition to being researched heavily by some of the greatest healthcare professionals that this world has ever seen right here in America, and in collaboration with folks abroad. So this is not something that folks should be afraid of, but should actually embrace, because the only way that we are going to get our economy back on track is by making sure that our communities are educated, by making sure that they have the resources that they need to feel comfortable with getting the vaccine. And ultimately, what I know that they all share, especially being at a food distribution drive yesterday, that folks are hurting and they're looking to get back to work. So this is a collaborative effort. We have everyone here who can answer your questions about the disparities in the community in terms of vaccination rates. But let's not forget that they are, and I say we are not, as a community, not just not getting the vaccination, but we are making sure that we have all the information that we need to feel comfortable to move forward to get that vaccine. And I'm sure that we have the partnership here to make sure that that happens.
So did you have? This is the North Las Vegas call center. There are currently 3 operational call centers. The state launched their call center 2 Mondays ago. Health District has 759-1900, I believe is the number. And then this is the North Las Vegas call center that's specific to this event, and it's tied to vaxnlv.com, which was the North Las Vegas registration site for the vaccination program that we're overseeing.
One more question?
One more question. Yes, sir.
What's being done by the city and the county to improve the efficiency of the appointment making? Because we've spoken with a lot of residents that say they can't get an appointment.
Yes.
It's booked up everywhere they go. I have a gentleman approached me this morning, and he said he's trying to come here because he needs his second shot. So what's being done to improve the efficiency?
No, that's a great question. And as this program has been built, you want to talk about that, Chief?
Yeah.
Okay, go for it. Chief Calhoun, go ahead.
So that's a good question. So that's something obviously that all of our partners in the Valley have been working on to try and get second vaccines as well as the first vaccines. First of all, the first vaccines and our ability to get appointments are completely based off of the amount of vaccines that we get in. So the city of North Las Vegas, and I know all of our other partners in the Valley, if we get vaccines, we have the ability to put out thousands and thousands and thousands a day. Just from our location at Canyon Springs, we can do 1,500 to 2,000 a day, but we don't have the vaccines right now to do all those times. The second vaccines are available. There's not a supply issue with getting the second vaccines. It's just an appointment issue. One of the things that I can say that we've done that I'm really proud of is when you come to our sites, you do not leave without getting an appointment for your second vaccine. So people know that in 3 weeks or 4 weeks, they know exactly where to come, exactly what time to come back and get their second one. I have been told that the new state system that's going to be unveiled in the next couple weeks to make the appointments is also going to have the ability to do that. And it's going to be a little bit more of a robust system. So we will be able to not only schedule first doses on there, but at the site, our people will have the ability within the state system to create that second appointment for them as well. So what we found, especially with this elderly population, they had a hard enough time. It was a big lift for them to try and find their first appointment, and the relief that they have on their face when they're able to know that they have a second appointment available when they leave, and they don't have to try and get onto a computer again or try and call a call center and do it. So that's one of the things we're really proud of through our North Las Vegas site, that we've been able to do that.
Folks, we can do some pull-asides, but for now we want to wrap things up, pardon me, just so that we have a few folks that are volunteering so that we can get some images of them getting their shots. We have a Spanish speaker as well. So we have a couple of people that we need to get moving, so we'll get out there. But we have 6 or 7 folks, so we can just go 2 at a time. We'll get images. We have a couple of the tables set up for you. Everything is good to go. So we'll get that coordinated. And with that, we appreciate you coming out.